Disconnection process that you have to follow. Number one, you want to wait for the patient to be out of the bed. Okay, you don't want to do this while the patient's in the bed. So once, let's say you're having a discharge today. Okay, and that patient's going home. As soon as that patient is out of the bed, what you'll want to do is right here, underneath your comfort level, the very bottom button is a disconnect button. Okay, you'll push that disconnect button. You'll see the pump, you'll see the light up yellow. And right now I can feel the pump working. It's blowing up the air cylinders that need to be inflated a little bit, and it's letting air out of the ones that need to be deflated a little bit. This is extremely important for a couple of reasons. Usually this takes about anywhere from 15 to 40 seconds, depending on where it's at in the process and where it was on the alternating pressure or the lateral rotation. But think about this. This is one reason this is so important to do is let's think about if you've got a patient who's you're doing lateral rotation on, and you're 14 and a half minutes into that cycle and you turn that pump off and that patient's discharged. The next patient that comes in and lays in that bed, they're going to be slightly turned to the left because the pump wasn't disconnected properly. Okay? So it's really important to do that disconnection process.
Is that why it was dipped too? Is that the same reason?
That can be, yes. Yeah. So
we
once
get that
that
a
light
lot.
turns, once that light turns green, that's typically what's happening is it was disconnected improperly. Yeah. So once that light turns green, at that point, you can come down here and you can disconnect the low air loss line from the pump, and then make sure that you disconnect all four of these. And also you'll need to make sure that all these connectors here are there and intact. Okay, I've seen these connectors have come out where they've been pulled and they'll come out, and when that happens there's nothing to hold the air in those cylinders, so that can happen too. But typically these have shut-off valves in there. I don't know if you can hear that air a little bit. So that's got a shut-off valve. So if that is not connected, that air is just going to escape out of there. There's no way to hold it in.
Say this bed has had 5 patients, in rotation, but they never needed the pump. When should we be checking to see if we need to re-inflate anything, if it was disconnected properly?
If the pump was disconnected properly and all your units or all your connectors are intact, it'll hold air. You don't have to. You don't have to check.
We don't have to inflate it in between patients.
No.